April 2021. And after 7 months on YouTube, now we have almost 12,000 subscribers. Looking back, what is it that we featured in the last 7 months? We talked about Ielts, OET, PTE, UK NMC CBT, and TOEFL. At the same time, we focused on the examination centers. We asked for their updates. So we spoke with the British Council, IDP, ACE Testing Hub, and Pearson of PTE. We also featured recruitment agencies and visa consultancies. So with almost 50 videos on YouTube, what else do we have to offer? So now we're going to feature a former Niner reviewee who passed OET and OSCE. So that's the topic for this vlog. OSCE, Objective Structured Clinical Examination. And I'd like to introduce you to Socrates Tiaga. Hi, Soc.
Hi, Ervin. How are you
Will you
there?
please greet our audience and our subscribers?
Sure, sir. Hello, everyone. Hello. Filipinos all over the world who are aspiring, just like me, to become one of our registered nurses in the UK.
We'd like to inspire everyone with a story of Soc right here. Why? Prior to the start of this vlog, I asked for the following. So in his case, he did not take the English examination first. Okay, curiously enough, he started with his UK NMC CBT and passed it on his first attempt in September 2021. After which, he took OET and passed it on his first and last attempt in November 2021. And guys, in just 2 months after passing, or after 2 months, he flew directly to the United Kingdom. So arrival, wait a minute.
Sir,
Yeah, that's fine.
21 yung nasasabi.
Yeah, it's okay. Anyway, this is just one take. We commit mistakes, human as we are. Okay, so going back, the month is actually correct. It's just the year. So guys, he passed CBT in September 2020. And then he took and passed OET in November 2020. And after 2 months, he arrived in the United Kingdom of Great Britain and Northern Ireland. That's January 2021. There, I got it right this time. And then he took Oski the following month. So that's February 2021. So he passed CBT, OET, OSCE in just how many months? That's September, October, November, December, January, February, in just 5 months. Voila. So now we're going to focus on OSCE, or Objective Structured Clinical Exam. So will you please discuss OSCE to our audience and subscribers worldwide?
Hi, everyone. So, OSCE is the second part of the NMC competency-based exam or competency exam for nurses or for registered nurses in the UK. So it is a practical exam to assess your competence that you are safe to practice the profession in the United Kingdom. So they have 3 testing venues all over the UK. So 3 universities are offering the exam. So it's University of Northampton, Ulster, and Oxford Brookes. So with my case, I chose the first one, the University of Northampton.
Okay, so for the benefit of our audience, our subscribers, you can take Ielts, you can take OET, CBT in other countries outside of the United Kingdom. However, OSCE is an examination that you have to take when you are already in the United Kingdom. Okay, so clarification, guys, you cannot take this outside of the UK. So as Soc mentioned earlier, this is the second step of your UK NMC test of competence. So the first one is known as CBT, computer-based test. You can take it wherever you are. And after that, you may apply for your visa, and upon arrival in the UK, it's up to you when you are going to take the examination. So CBT can possibly be taken every day. What about IELTS? Yes, there's computer delivered examinations. And here in the Philippines, it's available every day in Metro Manila from Monday to Sunday. What about OET? Well, depending on where you are, it's available once a month or twice a month. But what about OSCE? Do you have an idea how often is the examination conducted?
Well, actually, sir, the dates are depending on the university that is offering it. So the process is that you will have to email the university, those three universities, and then they will give you the possible testing dates. So they will be the one who will schedule you. If you are happy with the schedule, then they will pencil book you until you have paid the fee for the OSCE.
So it's not like IELTS and OET that you determine the test date. In this case, you have to express your intention first. You have to coordinate with the university or the institution for you to know the available test dates. Okay. Earlier, you've mentioned that there are 3 venues in the UK. Let me just clarify. So the first one, the one that you chose, that's, did I say it right? Hampton?
Northampton, sir. That's
Okay.
right.
That's in England.
Mm-hmm.
Okay, what about the 2 other venues that you've mentioned? Are they in England as well?
I believe so, but the Ulster, I think, is in somewhere in Ireland, Northern Ireland.
Northern Ireland. Okay.
Mm-hmm.
So guys, now you know that for the test dates, it's not as if you get to choose. You have to email first. And then for the venues, you have 3 options. There's one in England, there's one in Northern Ireland. Please check it out. Where's the 3rd venue? But for sure, it's within the United Kingdom of Great
That's
Britain
right.
and Northern Ireland. Now let's move on to the examination fee. IELTS in the Philippines costs 11,300 pesos. What about OET? 587 Australian dollars. So that's roughly 22,000 or 23,000 in Philippine pesos, depending on the charge of your credit card company. Not Google exchange rate, but your credit card company. And then CBT, as I was told, was roughly 5,000 pesos. Now, what about OSCE? So please inform our audience, how much do they have to prepare for their OSCE?
Well, this is quite expensive, so it's 794 pounds. But I am sure, or I am certain that some employers are actually supporting the fee for OSCE.
Okay, let's just do the mathematics because we want to be very detailed. So how much is that again? 700?
94 pounds.
794 Great British pounds. If we do the mathematics, let's just put it at 65, guys. Okay, wow, that's 50,000 pesos. So you have to look for employers that offer OSCE support because you wouldn't want to shell out 50,000 pesos. That's a very expensive examination. Before I move on to the next question, CBT is the one that tests your knowledge. But what about OSCE? What does it assess?
Well, it actually assesses both your knowledge and skills, sir. So the format is it's a practical exam. It has 9, 10 skills. Currently, it's 9 skills because of the pandemic. They are not assessing the BLS. But with the skills assessment, they're gonna assess 2 out of those 9, and then your API skills, your assessment, planning, implementation, which is the drug administration, and then your evaluation skills. So these are these will involve your skills and knowledge because you have to document, you have to demonstrate, and you have to verbalize all the necessary steps that you have to take whenever you are doing a skill.
Okay, guys. NMC, it's multiple choice. For OSCE, definitely, it's not multiple choice, right?
It is not, sir. It is not.
Because you're going to demonstrate specific skills.
Mm-hmm.
Are there specific instructions like this is what you're supposed to do, preparation time, and so on?
Yes, there are. So each skill, whenever you are given the skill, your assessor will give the skill, and you should know on top of your head what are the steps that you need to do. So there is the meet the patient, prepare the materials, and so on. And also your assessor will have to give the time. So it depends if it's going to be 12 minutes or 15 minutes. So it really depends on the skill that will be assessed on that uh on you on your side. So that's it.
Okay, IELTS, more than 3 hours if we're going to include the speaking subtest. OET, 3 to 4 hours. What about OSCE? How long do they have to allot for the examination proper?
Well, given that so let's say you have 15 minutes, all both skills for 15 minutes, and then for API is 15 minutes. That's 1.5 hour, but you will have to undergo breaks in between because they have to prepare all the materials for you to for the next skill to be demonstrated by you.
Just my opinion, quite an expensive examination. Like 50,000 pesos easily wasted in an hour and 30 minutes. So you have to take it seriously. Why? What are the implications just in case you do not pass OSCE? Okay, God forbid. What happens if the nurse who is already in UK does not pass OSCE? Should this nurse wait for, let's say, a specific period of time, like a week or a month before taking the next examination? Is there a possibility that the nurse is sent back to the Philippines? Please tell us the implications just in case a nurse cannot make it.
Well, as far as I know, sir, if you did not, if you failed one skill, you will just have to retake that specific skill. So you don't have to take all skill set. But you, as I can remember, you only have 3 chances of passing the OSCE. If you're not, I am not sure though if your employer will have to send you back home or you'll have to do a refresher course. But what I'm certain is that you can do a retake of that specific skill in case you just fail it.
So for those of you who do not know yet, yes, we've encountered nurses who were sent back to the Philippines just because they were not able to pass OSCE on their last attempt. So imagine you've passed your English exam, you were able to ace your NMC CBT. So this is the last hurdle. You have to give it your best shot. You don't want your efforts to go in vain just because you were not able to finish the last step. Guys, that's why you have to take this examination seriously. You choose a recruitment agency, you pick an NHS trust that offers OSCE support. Now, what about the availability of the result? For people taking IELTS paper-based exam, they have to wait for 13 calendar days in order for them to get their result. If it's computer-delivered exam, depending on the location, usually 3 to 5 days, the candidates get their result. For OET, it could be 3 weeks. What about CBT? It's available within 24 hours. For OSCE, how soon will you find out whether you made it or not?
Well, they said, sir, it's gonna be within 5 days. But with my case, I received it on February 15. So I took it on February 13. My friend who took it on a weekday received her result the day after. So I believe it's just gonna be 1 to 5 days, but it's within 5 days.
So their promise is 5 days, but if you get to find out your result before that, well, it's good news for you, so that you don't have to be sleepless for 5 nights. Now let's move
That's
on
right.
to the validity. IELTS result, OET result, both of them are valid for 2 years. What about OSCE? Any idea regarding the validity of the result?
Well, as far as I know, sir, since this is the exam, it is already good as valid. I mean, you are already UKRN. But I know that you have to have a renewal every year or so. But you don't
Okay.
have to take the exam.
Yeah, so once you pass the examination, that's it. No more examination coming after that. Okay, let's move on to the countries and visas that accept OSCE. For sure, if you're going to the United States of America, you have to take NCLEX. And NCLEX does not have a practical exam component. If you pass NCLEX, you can use that result for Canada and Australia as well. The case in the United Kingdom is totally different. So what about the countries or the territories that accept OSCE?
Well, most of the European countries, such as the United Kingdom, uh, Northern Ireland, and Scotland, are accepting OSCEs.
So when Sock did his research, he found out that OSCE is also acceptable in Belarus, Azerbaijan, but I don't know how many Filipinos are interested in going there. Definitely, you have to learn the language because it's not as if the locals are going to adjust. You have to adjust and you have to know the language of the locals. And when you go overseas to take care of patients, majority of the patients in nursing homes in nursing homes in Eastern European countries are not that well versed in English. So I just doubt if there are plenty of Filipinos who are going to choose that route going to Azerbaijan, Belarus, and so on. Let's move on. What about the grading system? In IELTS, it's numerical, where 9 is the perfect score. In OET, it's alphabetical, where A is the perfect score. What about in OSCE? Is it numerical, alphabetical, or what?
Well, it's just a pass or fail, sir. As what I've mentioned, this is a practical exam, and they are assessing your competence of practicing competence of safe practice in the United Kingdom. So they are giving guidelines. It's actually given with your access to the universities, what I say, review materials, and they have these guidelines, scoring guidelines, score sheets that you have to take note at the back of your head whenever you are doing the OSCE, because you have to observe these guidelines for you to pass the exam.
In English examinations, it's possible for you to challenge the grade that your examiner gave you. So in IELTS, we call this EO, or inquiry on result. Most people call it recheck or remark. What about in OSCE? Can you also challenge your examination result?
No, sir. If if they say that you missed a step, then you just have to retake that specific skill set. But the benefit is that unlike the OET, you don't have to take the whole exam. It's just that skill.
Great. Now we're down to our last 2 questions for this vlog. The next one, let's talk about your personal experience. How long did you prepare for OSCE? So what did you do before the examination, on the day of the exam, and after the exam? Because it's interesting if you know that someone did this and that and considered effective because apparently you passed the examination. So will you please share your personal experience to our aspiring UKRNs?
All right. So actually, sir, when I took the exam, it was nerve wracking. I was assisted by my visitor, Ian's. So they are the one who to trainee, they gave 2 week online review with their trainer, and then we have a 3 day mock exam in the UK. So this mock exam is gonna mimic what you are supposed to do in the OSCE. So it's gonna be a really exhausting day every day for those 3 days, because you have to do all 9 skills and then API, and then you have to do the mocks on the 3rd day. So that's happened how I prepared. And then I went to the University of Northampton by it was during pandemic. So yeah, February, still pandemic, and I had to go there alone, by myself. And I think before, what they do is that they will have specific rooms for each skill set. But here, you will only have a dedicated room all for yourself, so that you will be able to be assessed. I think this is their precaution for the pandemic, so that you will be only alone. You don't have to share the room with other people. So that's what happened to me. Uh, I think there were one, two, three. There were 4 of us who took exam that day, and none of us has the same format. So it could be actually skill one, skill two, API, or API, skill one, skill two. But with myself, it's skill one, API, skill two. So it was really exhausting. Uh, when you are there, you might say that you are confident, but when you're already done and you have time left, you will just think, did I do everything correctly? Did I miss anything? And that's where you should verbalize what are the steps that you might have missed, so that you'll be able to at least save yourself from demerits or deductions. Your assessor might actually give you a consideration, or she may not. So it really depends. So the safe side is you should be aware of what you are doing. So for myself, my skill set was for IM, uh, urinary catheter removal, and API for a pre-op and post-op patient. So that was my experience. And after that, it was an exhausting day. So when I went home, I just kept thinking to myself, I did great. But there's doubt. It's really normal. And then after 2 days, email came in, and they will say, it said there that I already passed the OSCE.
Great. Guys, just to let you know, we are not offering, okay, 9.09 for the record is not offering OSCE review. But why are we doing this? At the end of the day, what is the long-term goal? For you to become a citizen of the United Kingdom. That's why we're tackling every step of the application. So we offer Ielts review, we offer OET review. We no longer offer UK NMC CBT review, but we did an overview of vlog related to that, which is considered helpful to our candidates. Now, this is OSCE that we are featuring because it's part of the process. So you notice that we're not selling anything related to OSCE here. We just want you to know what could possibly happen on the day of the examination and what to expect. Now, for our last question, knowing that you passed UK NMC OSCE, what perhaps is the best test-taking strategy that you like to share to aspiring UK RNs?
Well, for OSCE exam, sir, you have to find the right people. Able to Being able to find support, the right support that will aid you on the review, will actually give you an advantage. I am lucky actually to have found Ian's, because they're offering both visa application and the OSCE training. So that's one. And two, whenever the materials are being given to you, you have to practice, practice, practice. You have to memorize, memorize, memorize. Why? Because you are time bound. You only have 12 minutes, you only have 15 minutes for a skill set. And you don't really, literally, you don't have a minute to think. You just have a second or a couple of seconds for you to think what is the next step. And it should be muscle memory for you to pick up whatever it is that you need to pick up, to read whatever it is that you need to think, to read, and to say whatever it is you need to say. So it is really practice, memorize, and yeah, practice. Actually, that's what I did. Lastly, you have to be confident with yourself. I know it's not really easy to be confident, right? It's not easy to trust yourself, especially like myself. I think my work gap is almost already 5 years. So I am not that really confident when it comes to skill set. But I know when I did the practice, when I did the training, I knew that I was well equipped. So what I just needed was to give myself some boost my confidence, so that I'll be able to think properly, act properly, and speak properly, because that will actually what's gonna happen. And so with that, you have to have all those three components for yourself, so that you'll be able to pass the OSCE and become a UKRN just like myself.
There you go. Straight from Socrates Tiaga, who passed OET, CBT, and OSCE. So if you consider this content helpful, please pay it forward by sharing to your friends. Now, just in case you have friends who are nurses but are totally undecided, totally unfamiliar with what they're supposed to do, maybe, just maybe, after watching this, they might want to pursue a career in the United Kingdom. So once again, this is Coach Sock, and this is Sir Ervin saying thank you for your time. Hope to see you in our future vlogs. Bye-bye.
Bye.
You can also visit our website at www.nineronlinereview.com or email us at training@nineronlinereview.com. And guess who replies to all of these?
Who replies, Sir Ryan?
Us, the lecturers.
Yeah, so we are really hands-on when it comes to taking care of you. Why work with anybody else but the best?
See you in our future video.
Thank you for watching.